But the big story that's been breaking this evening, the government of India has announced a new vaccine strategy after a review meeting chaired by Prime Minister Narendra Modi. The new policy comes into effect from the 1st of May. As per the policy, everyone above the age of 18 will be eligible to get a vaccine against COVID-19. Vaccine manufacturers will sell 50% of their produce to the centre, remaining 50% to states and in open markets. The states will be allowed to formulate vaccine policies based on their needs. The decisions were taken at a crucial meeting chaired by Prime Minister Modi. It comes at a time when the government's vaccine policy has been under the scanner, with former Prime Minister Dr. Manmohan Singh writing on the issue to Prime Minister Modi. Let's go straight across to Milan Sharma for the very latest. Milan, give us a sense. This policy now comes into effect, we are told, from the 1st of May. But several questions remain unanswered, including the big one. Does the government have the vaccine stocks to start providing vaccines for all above 18 from the 1st of May?
Well, Rajdeep, that's a very crucial question, and the answer to that was given to the Prime Minister today in the meeting that he has chaired, not just with the doctors and the National COVID Task Force, but also with the pharma companies, wherein vaccine stocks and supplies is something that he has taken the cognizance of. We already know that we have Covishield and Covaxin. Now, both manufacturers have been given a grant of rupees 3,000 crores from the government today, that the Finance Ministry has given them this money for production. We also know that Sputnik V has now got an emergency use authorization, so that will also be looking to vaccinate a lot of Indians. For now, Sputnik will be importing some vaccines, but very crucially, Rajdeep, remember last week the government had said that we will welcome Pfizer, Moderna and Johnson & Johnson to enter India as well. So they've taken stock of all these companies that are coming forward with the COVID-19 vaccinations, and especially at a time when the cases have surged to their max limit. We still don't know when the peak will come. It's very crucial for the government to have said that we will vaccinate all above the age of 18 now. And that is the big decision that will decide what is the course of action that the pandemic will take now.
Okay, Milan Sharma, with all those details, of course, we will look at that vaccine policy very carefully in the days ahead. Several important unanswered questions as to how will this new policy be implemented. Thanks very much, Milan, for joining us. Now, of course, vaccines and vaccine shortages remain one big challenge for the government. The other big challenge increasingly is oxygen supply. Remember, coronavirus in most instances attacks the lungs. Therefore, oxygen supply has become critical. Now, several states, including Delhi, Maharashtra, Chhattisgarh, Uttar Pradesh, have expressed the view that they are running short of oxygen supplies and asking for the centre's intervention in the matter. India is now planning to import 50,000 metric tons of medical oxygen to cater to the rising demand, and the Railway Ministry says they've set up an oxygen express. The question though is, how will this all work on the ground? Because on the streets and in hospitals, people are struggling to get oxygen supply on time. It's one of our top stories tonight.
In search of a bed, this family had been roaming the streets of the capital, knocking on doors from one hospital to the other. Even the ambulance ran out of oxygen. They had to arrange an oxygen cylinder on their own so that life could continue to breathe.
5.5 घंटे से अलग-अलग अस्पतालों में घूम रहे हैं। एम्बुलेंस में ऑक्सीजन खत्म है, प्राइवेट गाड़ी में ऑक्सीजन लेकर के इन्हें अपने पेशेंट को लेकर के जाना पड़ रहा है। एम्बुलेंस खाली की गई है, एलएनजेपी अस्पताल पीछे है, कई सारे अस्पताल, आचार्य भिक्षु और तमाम हॉस्पिटल में इनके परिजन बता रहे हैं कि वो गए थे, वहाँ सब कुछ खत्म हो गया।
The deadly second wave of COVID has left the country gasping for breath as oxygen supply is running short. And where people could find oxygen, there were no beds to rest on.
अस्पताल लेके मेरे पास आके मैं इसको लेके आना मेरे पेशेंट को सीरियस है ना, सांस की प्रॉब्लम चल रही है, पेशेंट चल नहीं पा रहा है, क्या करूं मैं?
Social media is flooded with cries of help, and people can be seen running around in panic. not just outside hospitals, but also around manufacturing units.
300 ऑक्सीजन सिलेंडर के लिए खड़ा है। सत्यव्रत हॉस्पिटल से है। पूर्व में यहीं से सप्लाई होता था ऑक्सीजन का हम लोग का। आज हम लोग का पेशेंट वेंटिलेटर पे है और उन लोग को ऑक्सीजन नहीं मिल रहा है। कोविड पेशेंट भी है, क्या करें हम लोग।
8 दिन से मैं घूम रहा हूँ तो बोलते हैं हम बेड दे देंगे तो आप ऑक्सीजन लाओ, आप रेमडेसिविर लाओ तो ही आपको बेड मिलेगा, नहीं तो बेड नहीं मिलेगी। एम्बुलेंस को फोन करते तो बोले आपके पास बेड है तो ही हम आएंगे, नहीं तो हम नहीं आएंगे। मतलब लेकिन लाए तो लाए कहाँ से। आज 8 दिन से मैं सिर्फ ऑक्सीजन के लिए घूम रहा हूँ।
In Maharashtra, tankers are being sent to fetch liquid medical oxygen from various states.
Now these very tankers will be sent to places like Jamshedpur, Bokaro, Vizag, Rourkela to fetch liquid medical oxygen. Yes, that's right. In this time of crisis, the Indian Railways have stepped in to help the government of Maharashtra. But still, it is going to take around 3 to 4 days for these tankers to reach up to their destination and return. Officials say that around 15 to 16 ton is the amount that each and every tanker will be able to get. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Now, oxygen supply remains, of course, as you saw in that story, a major challenge. The other big challenge at the moment is availability of the drug Remdesivir that is being used for COVID treatment in various hospitals. Now, one of the problems is Remdesivir is being hoarded and black marketed in several parts of the country. So our India Today investigation team has gone to Delhi and Gurugram and found that in some places Remdesivir is being sold over 6 times the retail price. Take a look at this special investigation.
Flying off the shelves.
मैं यहाँ पे 3 दिन से लाइन में खड़ा रहा हूँ। आज भी मेरा नंबर आने वाला नहीं है क्योंकि यहाँ पे अंदर से बोला है कि 700 लोगों को ही देने वाले हैं और मेरा नंबर है 878। मैं सुबह 6 बजे से लाइन में खड़ा हूँ पर मेरा नंबर आज भी आने वाला नहीं है।
Shortages of Remdesivir compound the COVID crisis.
रेमडेसिविर की कमी होने लगी है क्योंकि केसेस बहुत ज़्यादा तेज़ी से बढ़ रहे हैं। इस वजह से इन सारी चीज़ों की कमी भी, जो हमें लगता था कुछ दिन पहले तक की स्थिति, ये चीज़ें उचित मात्रा में मौजूद हैं। आज ऑक्सीजन की, रेमडेसिविर की और टोसिलिजुमैब, इन तीनों की कमी नज़र आई।
An India Today investigation has found how sharks in the pharma supply chains are exploiting the grim situation, black marketing the medication by obscene amounts as the cases peaked. Seven companies manufacture the drug in India. Their retail prices range between 900 rupees and around 3,500 rupees for a 100 milligram vial. Following a tip, India Today's investigative reporter reached out to this black marketer of Remdesivir. He offered this drug for 20,000 rupees a vial, almost 6 times its official retail price.
भाई उन्होंने कम रेट बताते थे। भाई रेट का यही तो सीन है, जब उस टाइम पे मिल रहा था, कल तो आपको 17.5 के हिसाब से मिल रहा था, अभी नहीं मिल रहा।
अभी 1 रेमडेसिविर के कितना लगेगा?
20,000। हाँ जी।
तो पेमेंट
नहीं, आप मेरे को करें, आप मिल सकते।
At Delhi's Yusuf Sarai market, this vendor agreed to supply Remdesivir for around 14,000 rupees a vial. He claimed the product would be smuggled out of a hospital. No guarantee about the genuineness of the drug though.
रेमडेसिविर 100 mg आयु का डोज मिल जाएगा। कितना डोज चाहिए?
अभी तो फिलहाल 2 चाहिए, लेकिन हमको टोटल 6 चाहिए। लेकिन 2 डॉक्टर बोले 2 अगर लग जाएगा तो अभी फिलहाल
थोड़ी रिकवरिंग हो जाएगी। ऐसा है, 2 डोज मिल जाएगा। डॉक्टर हॉस्पिटल से निकला हुआ सामान है, जहाँ उसका MRP है वो हटा रखा फार्मेसी का, जेन्युइन आइटम है कंप्लीटली। और ये मान के चलो, अगर 2 डोज भी मैं इन्वेस्ट करके किसी ने मिलना तो 28,000 रुपये की 2 डोज हम करेंगे। एडवांस लूँगा, मेरे को आधे घंटे का टाइम है, मैं आपको दूध अवेलेबल करवा दूँ 2 डोज।
Remdesivir is a prescription drug. 6 doses are usually recommended for the sickest hospitalized patients for over 5 days.
No home isolating patients need remdesivir. They should not be given that. Even in hospitalized patients, which will be 5 to 10% of the whole positive patient population, only 5 to 10%, and even in that, it's a very minority of them on which remdesivir can be tried in specific situations. There are better drugs.
Hit by the shortages during the new surge, the government announced plans to boost existing capacity.
पर डे 1,35,000 वाइल आज के दिन में प्रोडक्शन में आ गए हैं। अगले एक सप्ताह में 2 लाख तक पहुंच जाएंगे और 15 दिन में पर डे 3 लाख वाइल का प्रोडक्शन हो जाएगा। देश में प्रोडक्शन बढ़े, इसके लिए हमने 20 प्लांट था, दूसरे 20 प्लांट को परमिट कर दिया।
For now though, black marketeers are making hay while the pandemic rages on. This pharmaceutical vendor at Saket in Delhi offered 100 milligram vial, 5 times the official price.
किस कंपनी का होगा?
ये
हाइड्रो का रेमडेसिविर ना। अभी कोई चाहिए?
आपका पेशेंट खाना है एडमिट। हाँ? पेशेंट खाना है एडमिट।
तभी तो भटक रहे भाई। कितने का?
18,000 का लिया मैंने, एक ही में।
कितने का?
18,000 में सिंगल लिया।
तो 18,18 36,000।
36,000
कितने देर में मिल जाएगा?
और यहाँ भी नहीं पकड़वाएंगे वो। हाँ। बाहर ही पकड़वा देंगे आपको दोनों।
मतलब दुकान से नहीं, बाहर से?
दुकान पे तो मैं वही चीज़ कह रहा हूँ, पकड़ आपको।
The pandemic fuels greed once again, this time during its second surge. Muhammad Hizbullah for IndiaToday's special investigation team.
So what are the solutions to the crisis of oxygen supply and remdesivir? I'm joined once again by experts, doctors, as we often focus here on the news today. Dr. C.N. Manjunath, Karnataka COVID-19 Task Force member, Dr. S.K. Sareen, Director, Institute of Liver and Biliary Sciences, who's been closely associated with Delhi's COVID efforts. Dr. Jaleel Parker is Senior Pulmonologist at Lilavati Hospital, himself someone who's recovered from COVID-19. Dr. Hemant Deshmukh is Dean at the St. GS Medical College and KEM Hospital, one of Mumbai's leading hospitals. Appreciate all of you joining us. Let's start with the oxygen crisis first. And Dr. C.N. Manjunath, why don't you take that, since you've been a member of a COVID task force? What explains the shortage of oxygen supply, given that we are one of the largest producers in the world? Is it that there has been a problem in terms of just the excess demand, or were there supply constraints? What explains the oxygen crisis that many parts of the country are facing today, Dr. Manjunath?
Yeah, actually, oxygen, what happened in Karnataka, we have 17 medical colleges and nearly 30 district hospitals. When the curve started flattening, the first curve started flattening somewhere in October, November, Karnataka government went ahead and reinforced their oxygen capacity. All medical colleges today, including this district hospital, have very big oxygen plants, liquid oxygen plants. And also in the last, even January itself, Karnataka government added lot of these oxygen generators, where you can generate oxygen from the atmospheric air itself. So in that way, as of now, at this point of time, the government institutions in Karnataka are not facing any oxygen shortage. But unfortunately, yes, in smaller hospitals, smaller private hospitals, and smaller taluka hospitals, I mean, particularly private hospitals, there is a shortage. And other thing, yes, there is an increasing demand. There is no question about it, because the way the number of cases are piling up in India, almost 2 lakh cases are piling up. Definitely in days to come, we'll fall short of oxygen requirement. And the increase, because nearly 5 to 10% require oxygen.
So you're saying
it should be judiciously used also.
You're saying the problem was largely in the smaller. You're saying you're saying much of the problem was where it is today is in smaller hospital, but that's not true across the country. Dr. Jalil Parker, we had a situation yesterday where the Maharashtra government says, look, we are running out of oxygen supply. Last week, Uddhav Thackeray actually calling for the Indian Air Force to be used to fly in oxygen supplies to Maharashtra. Is the problem partly at the transportation leg? Because now you've got an oxygen express that the Railway Minister Piyush Goyal has said is kick-starting today. Where is the problem? Why is it that oxygen supply in Mumbai and indeed in parts of Maharashtra has become such a big issue? Is it again the rise in demand, or were there supply blockages?
Rajdeep, are you asking me this question?
Dr. Parker? Yes, I'm asking you this question, Dr. Parker. Yes.
Yeah. Rajdeep, see.
Yes, yeah. Dr. Parker, go ahead.
Rajdeep, see, these questions I don't think should be directed towards us, because we as physicians, we know only one thing, and that is to treat a patient and to save their lives. Of course, we do mention when there is a shortage of whether it is oxygen, whether it is medicines, vaccinations, etc., life-saving drugs, etc. But at the end of the day, in this COVID tsunami that is going on, we have no time to breathe. We don't even have time to think. We are all exhausted. And where is the short, whether it is because of sheer volume that the oxygen supply is falling short, or whether, it is the logistics. I don't want to get into it, and I don't want to know it also, because I don't have the strength to understand this. What I need at this moment is I need oxygen, I need beds, I need the crucial medications, Remdesivir, tocilizumab, and what I need is vaccination to each and every one. I'm very happy that today the Prime Minister has announced that above 18 everybody should be vaccinated. And I welcome that decision, and I'm sure that each and every citizen in India takes this opportunity to vaccinate oneself rather than landing up into an hospital in a critical state and dying.
Okay, so you're saying, look, you have no time to find out where the blockages are. You're just too exhausted with the number of patients that you're getting every day. But Dr. Sareen, if I were to pinpoint anyone to blame for this oxygen crisis, who do we blame? Because remember, it took 8 months for the government of India to invite bids for over 150 oxygen generation plants costing just over rupees 200 crores. 6 months later, most of them still aren't up and running. So, I mean, I'm just wondering whether we were just unprepared or behind the curve on this second wave when it comes to something as basic as having the necessary oxygen capacity, Dr. Sareen.
Thank you, Rajdeep, for calling me, and I would simplify for the sake of listeners, for the patients, for the hospitals and the doctor, my colleagues also. Of the people, 100 people who go to hospital, 10% require oxygen, 90% don't require. Those who do not require may require in due course. If they lie on their tummy or on their side, the back of your chest, the lungs can be recruited and your oxygen can increase. That's number one. Number two, India produces close to 7,000 metric tons of oxygen a day, and we are using only 54% of that. Half of that it is still not used. The problem, of course, is increased demand. The problem is also that we need to have more oxygen production, but we have to remember that it is not oxygen which is taken in a pipe. You need cryogenic tankers. You need that this oxygen is compressed into a very cool tanker which takes it away. And at the site where it reaches, you remove that oxygen and decompress it into a manner that it can be filled into small things. And further, you go to rural area, it will be more difficult to take the oxygen. So first thing we realize, production, of course, then the transport, which the government has very rightly done. But third and most important part is the need for oxygen. Does everyone need it? Yes, doctors know that. Now there is an alternative to that. There were oxygen concentrators. There is a device by which you can have the adsorption of oxygen onto a surface. This is a technique by which small hospitals can also make that available. And these can be planted within days' time. This, what is known as pressure swing adsorption, this is a technique by which I think you can put up small plants in 2 to 4 weeks. So these pressure swing adsorptions are being placed. So what I would like to assure people, yes, there is a need, increased demand, there is a need to transport faster, but there is no need now just to say we don't have anything. We as doctors can manage. Sometimes if there is no antibiotic, still we do something else. If there is no ability to operate, we still do something. So I would give a positive note. All of us learn to do with what little, we do not waste it. We accept it, and I do hope that the supplies will increase within next 2 to 3 days. And also, like Maharashtra needs close to 2,000 tons a day because of 1,500 tons a day. If any state has excess oxygen, there are several states which are producing more. Inox is the one which makes 60% of oxygen for the country. So those states, those areas where there is oxygen should volunteer, and I'm sure the group of ministers must be monitoring to transport it to places. But small places, we have to manage at our own.
Well, that's been one of the problems. Doctor, that's been one of the problems, interstate problems, even when it comes to supply. There's been a bit of a spat over the weekend between Maharashtra and Madhya Pradesh over oxygen being supplied or oxygen machines being made available. But I also want to look at our other focus, which is Remdesivir. And Dr. Hemant Deshmukh, because you are dealing with a number of patients in one of Mumbai's largest hospitals, KEM. Yesterday, the public statement by professional bodies, task forces, as well as leading medical professionals was, please use Remdesivir rationally and do not misuse it. Do not use it at home, use it very sparingly. Is part of the problem that Remdesivir is being used by people in an irrational manner? Are you finding that? And what is your advice to people when the moment they get a prescription, they say, well, we've been told by our doctor to use Remdesivir. How would you respond to people who are saying, when do we use Remdesivir, doctor?
Yeah, Rajdeep, what we have found in the city of Mumbai was you'll get multiple calls, you'll get multiple messages regarding such and such, my relative is admitted and kindly arrange for Remdesivir. But Rajdeep, one thing is very clear that the entire COVID situation in Mumbai is by and large managed by the Municipal Corporation of Greater Mumbai with the help of all the private hospitals that are thriving in Mumbai. The use of Remdesivir has been adjusted as per the needs of the individual patient, and there has been always a protocol of how and when to use Remdesivir in these critical patients. Now, this time, the second wave, or what you normally call this as Corona 2.0, the use of Remdesivir has not gone up. This was always there in the first phase of coronavirus also last year. But this time what we are seeing in a very funny manner is the patients who were there at home for 5 to 6 days, which simply means that the patients are coming to the hospital in a critical state at a much later stage than what we saw in the first wave of corona. This simply puts us more demand for the oxygen, and plus whatever resources the relatives want. This time the corona is affecting the more educated one, the newer age class, and probably the people who are more prone to listen to Dr. Google or Dr. WhatsApp. And that's how we come to know that they want Remdesivir, they want oxygen. But this time you have seen that the high flow nasal cannulas, which are actually oxygen guzzlers, are being used rampantly. So rather than improving the supply of oxygen, which we are always doing it at our front end, on the backside, the healthcare workers or the practitioners or the treatment doctors are watching also closely on the rational use of oxygen. The high flow nasal cannulas, which were very rampantly used in the first wave, are being diligently used this time. Since they are oxygen guzzlers, now we have shifted to non-invasive ventilation also, and that has cut down the consumption of oxygen surprisingly to 10% less than what we were about 2 months back.
But No, what I'm still trying to understand, and maybe Dr. Parker, you can come into this, because I know you had to use Remdesivir presumably when you were affected by COVID. Let's get this very clear. When is it that a patient should use Remdesivir? This will be of great use if you can clarify this. There are shortages of Remdesivir being reported from Nashik, from Nagpur. Even courts have now stepped in Nagpur asking the government to ensure greater stock of Remdesivir. We've shown in our story hoarding, black marketing going on. Not everyone can afford these high prices. I want to understand very clearly from you, Dr. Parker, when do you recommend Remdesivir to be used by a patient?
Rajdeep, it is easier said than done. All those who are sitting in the corridors of power or who are sitting on the chairs, they should come to the ground realities on the war front. If a patient comes to the hospital gasping for oxygen, what is it that we have to do as physicians? We are supposed to save his life. COVID-19, the treatment of COVID-19 has very few limitations. You have very few medications. So if you are saying that Remdesivir is not to be given to the patient who comes to the hospital, what is it that you want to give? Do you want to give Fabiflu to the patient who comes to the hospital? Do you want to give ivermectin? Do you want to give doxycycline? Do you want to give HCQs? Do you want to give azithromycin to the patient? No. The patient has come because his saturation is falling. He is developing COVID pneumonia. You have to nip it in the bud before the patient goes on BiPAP or on an invasive ventilator. Please try to understand this. If high flow nasal mask is the need of the hour, it should be used. The question is that not that we are abusing the usage of oxygen. That is very wrong. And it is very inappropriate for a doctor to make these comments. I totally disagree with this. Now, whatever questions you want to ask regarding the supply of oxygen, regarding the supply of ventilators, concentrators, whatever it might be, it should be asked and it should be echoed in the corridors of power, and it should never be questioned to the physician, because the physician, the nurses, the technicians, we are all tired of serving humanity. So please do not question what we are doing.
No,
we are doing it thanklessly. Again and again and again. And it's over a year that we are doing it.
Sir, I'm not questioning you. I repeat, I am the father of a doctor who, who has spent most of the last 1.5 years night and day working on COVID along with his colleagues. So I can understand what it means. I just want to come to you, Dr. Deshmukh, to answer that question once for our viewers. Remdesivir, when do we use? When do we use, Dr. Deshmukh?
Yeah, Rajdeep. The rational use of Remdesivir as when we use Remdesivir, it definitely reduces the replication of the virus, and it needs to be used appropriately. Definitely, each physician has clear-cut indications, clear-cut guidelines of when to use it. But if the patient comes on a very delayed note, if the patient comes much later than what he is anticipated to come, the use of Remdesivir may not definitely improve the mortality, but the ideal time would be 6 to 7 days from the first day of symptoms. So it is very crucial for us to understand that what is the first day of the symptom, what is the first day of the disease, which most of the patients will not be able to recollect or recognize. And this makes the treatment of COVID-19 with Remdesivir, with oxygen, again difficult, because the saturations are dropping. This is the only antiviral drug which is available right now, which has to be given on a parenteral basis, which needs to be given only in a hospital setup. And that's why whatever time the patient comes, we have to give Remdesivir.
Yes. The problem, of course, is in parts of the country it's not easily accessible. Just one more question, Dr. Sareen, on oxygen beds and ICU beds. You know, there seems to be a great demand in Delhi, for example, for ICU beds. The government has thrown up its hands, the Delhi government, saying, look, we are running short of ICU beds. However, we are finding oxygen beds are more accessible. should patients be looking for oxygen beds rather than the first thing they say, we want an ICU bed and that too in a private hospital?
Well, this is clearly the way the hospitals flow are. Patients who are not very sick will go to general routine monitoring. Once their oxygen and saturation drops down, they will go to an oxygen bed. And when the oxygen, which is given either by nasal cannula, 3 liters, 6 liters, or even 10, and if it doesn't, then on high flow oxygen, then if they are not managed, then they go to the ICU beds. So this is the way the severity demands the management of the patients. So if there is an oxygen bed available, at least there is some hope that this patient will be very closely monitored by specialists.
Right.
All the drugs that are required will be given. And if the beds are available, ICU bed means you need a ventilator and you need a specialist. It's just not the machine. And Delhi has done fairly well. It has ramped up its capacity. But this surge has been unprecedented. And I think the center and the state... Yes.
Sir, you all keep saying that we have done well. No one doubts the challenge before, but I get calls at midnight now from people desperate for a bed. So clearly this is a crisis. Let's accept it. There is a crisis of beds, there's a crisis of oxygen supply, and in some parts of the country there's a shortage of Remdesivir. And as Dr. Parker said, that doctors are now exhausted. They also, and we'll be discussing this one of these days, the sheer exhaustion levels that have affected doctors across the country. And we may soon face a shortage of doctors even at this rate, because many of them themselves are being felled by COVID-19. I thank all of you for joining me. We will, of course, get many of you back again for many more questions. We will carry forward these debates to find out exactly solutions to the crises that are facing the health infrastructure. So thank you all very much for joining me here on the news today. Now, how is the world looking at the crisis in India? Over this week, we will also bring in global experts who are looking closely at the situation in India. I spoke earlier to Dr. Ashish Jha, public health expert in Brown University in the United States. Listen in to what Dr. Jha had to say. Dr. Jha, I want to understand from you, from your vantage point, as you look at what is happening in India, 2 lakh cases per day, numbers constantly rising. Do you believe that this is, that India has faltered somewhere? Or do you believe in the natural course there will be these corona waves from time to time? Is there something wrong with our policies that's responsible for these increased numbers? Or is it natural course?
Yeah, so thank you for having me on. First of all, I will say I am very worried about where India is right now. 2 lakh cases a day is very high, but I don't see it slowing down right now. I don't see this being the peak. I worry it will continue increasing. That is the nature of this virus. The mistake here, I think, is over the last few months, I heard both from policy people as well as others, this sense that somehow India had beaten coronavirus, where the rest of the world was still struggling. There is nothing special about India that makes it immune to the coronavirus. We Indians are just as susceptible as everybody else. And I think there has been a relaxation of policy. I think there has not been enough focus on prevention. And this is, unfortunately, the result of all of that.
Are you therefore saying that it is COVID inappropriate behavior that is responsible for it? Or is it COVID inappropriate governance, or a mix of both that led to a lowering of the guard and a certain complacency?
Yeah, I think the complacency is both. It is both from inadequate policy attention. Again, just even a couple of months ago, I was hearing from leaders in India that COVID was done and we had beaten it. And then, of course, on an individual level, I was hearing from family and friends in Bihar and elsewhere their argument that India had beaten it and therefore we could go back to normal. And it made no sense to me because I'm not seeing any other country having beaten this. And so I thought, why is India going to be different? And I think that led to a lowering of the guard, of relaxation of policies. We are seeing this with large crowds around elections, around other things. very, very dangerous. And I think it's unfortunately fueling a lot of the infections we're seeing.
From your vantage point again, what is it that India could learn possibly from other countries that are going through similar waves as part of the nature of this virus, as you called it? What could we learn from the United States at this particular moment, whether in terms of vaccination drives, whether in terms of other policy measures that need to be taken?
Yeah, I think we can. India can learn from the U.S., but can certainly learn from Europe. What many European countries are doing in face of a major wave that Europe has been facing. Look, there are 3 or 4 things that keep this virus under control. One is certainly universal mask wearing. That Indian policymakers should be wearing masks. They should be promoting mask wearing across the country. People should not be gathered in large groups without wearing masks. And people should really avoid indoor gatherings as much as possible. That's number one, mask wearing. Second is crowds and having fewer large events. Again, I've been seeing pictures coming out of India of these massive gatherings. Very, very concerning. Now, again, safer if it's outside, very dangerous if it's inside, but really pulling back. Third is I think we need to do more testing. India has done a pretty good job on testing, but one of the advantages of large-scale testing is you find more infections and you can stop them from spreading. And then certainly last but not least is continuing to push on more vaccinations. India has a lot of vaccines. It's been doing a good job on vaccinations. It has to drive those vaccination drives numbers even higher for a population its size. All of this is a way to prevent lockdowns. If nothing else works, then you're looking at very aggressive, tight lockdowns. But that's a very costly measure. And my hope is that India can avoid that across the country. I know in some places we're starting to see lockdowns, but I think that should really be the policy of last resort when everything else has failed.
So in your view, therefore, as you said, lockdowns only as a last resort. Is there a critical stage at which a country must decide when to go in for a lockdown? Some countries have been very effective with their lockdowns. Others have, as you rightly said, have found them extremely costly. So are you saying that this is too early, premature for India to go in to even consider the potential of the possibility of a nationwide lockdown? Are you saying have tight, localized lockdowns?
Yeah, I don't know that a nationwide lockdown would make sense given how regional the infections are and how the outbreaks are. So I would certainly try to limit it to local areas as much as possible. I think that's one. Second is that, lockdowns, as I said, are the last resort. So when should you trigger them? When you start seeing the healthcare system truly get overwhelmed. I'm seeing stories out of Mumbai, Nagpur, elsewhere, where hospitals are running out of beds. That in some ways is kind of on the late side. You want to see, once you start seeing a surge of hospitalizations, you are in trouble. And that's when you got to get much more aggressive, maybe including lockdowns. But the hope is to never get there. And when I look at the India data, case numbers have been rising for 2 months. By late February, it was very clear that another wave was coming. And, here we are mid-April. But policy response is just too slow. Like, if you wait until you have this many infections, things are going to get much, much worse. So acting early is the key here. Right now, I think localized lockdowns make some sense where hospital systems are really struggling. But other than that, I would try to avoid anything national.
Would you also support vaccinations for all, that rather than have targeted groups, try and expand the vaccination pool in the fastest possible time so that all over 21 are vaccinated if they choose to do so?
Yeah, this is a tricky one because, of course, we know that it's older people who are at highest risk for death and complications, but we also know that it's the young people who tend to spread the disease. So there's a balancing act here. What I would say is certainly trying to make sure older people are vaccinated to protect them. But if you're running into any hesitancy, if you're running into populations where you're having vaccines sitting around but not getting them, absolutely then expanding it to other people, young people, is a good idea. The problem here is we don't have a lot of experience with starting with young people first, and most countries have focused on older people initially. But given the shape that India is in, I would certainly be willing to vaccinate a lot of young people if that helps slow down the transmission.
One worry, of course, in the Indian context, Dr. Jha, is that in a vast, densely populated country, how do you achieve social distancing? This was a problem we faced during the first wave. It's a problem even now. People need to go out to find work. In some instances, of course, going out for festivities and rallies, which, as you said, is a clear no-no. But how do you communicate the need for social distancing to a densely populated country where at times it is a necessity to simply be out in these large numbers because that's because of the way people live their lives in very congested localities?
Yeah. No, it's obviously very difficult to have true social distancing in many parts of India. I think about, I grew up in Patna. It's not a city where you can get a lot of social distancing happening easily. I will say a few things. First is, I think anything that is unnecessary, that is not absolutely essential, should be canceled right now. So festivities, elections, I don't know if you need to cancel the elections, but collection rallies should certainly be canceled. And if you're going to hold any of them, you got to have everybody wearing masks. Second is, I do understand that people need to get out and do things. What the two things that we can do to make them much safer are make sure as much of it is outside as possible. So things that are outside tend to be relatively safer. And second is mask wearing. If people are out and about doing things, but they're wearing a mask, that will help a lot. Again, it's not ideal, but nothing here is ideal. What we want to do is try to reduce risk as much as possible.
Dr. Jha, one final question. In terms of communication, the government in the first wave had this Thali Bhajao, Diya Jalao, all kinds of campaigns launched to build consciousness of the need for social distancing, for masking, for support for COVID warriors. Would you suggest course correction? Has the time come to focus less on event management, as some call it, and look at science and data much more seriously and then communicate?
Absolutely. What we have seen in country after country around the world is countries that have done a good job of managing the pandemic, countries that have done a good job of stopping large outbreaks. You've had very clear communication from political leaders. We need that starting from the Prime Minister all the way down to chief ministers, health ministers, others. Everybody needs to be talking about the science and evidence and what it is that India needs to do to get through this. The good news is that this pandemic will end. It will end when a large proportion of India is able to get vaccinated. Until then, we have to be very careful. Right now, we are in a crisis in India. It needs to be brought under control before things get much worse.
So would you say that, the crisis has in some way been mismanaged? Or would you say that the government has done a reasonable job?
I would say there has not been enough communication from the government about the seriousness of where we are. There has not been enough focus on these rising cases until things got very bad. The policy response here is too slow and the communication is ineffective. We need much more aggressive action from policymakers at the state and at the central level.
And even if, let's assume the cases taper down, you're saying there's no room for complacency. Are we looking at another 6 months to even a year where we will continue to get these waves? Is that the worry that most health experts have, that this is not going to stop in a hurry?
This is not going to stop in a hurry. This is going to take a while. But here's the key point. You don't need waves this size. If you act early when you start seeing waves, you can usually stop them with relatively mild measures. If you let it get out of control and take off, then yes, you have to get very aggressive. So the key point here is to be much more proactive. get this wave under control, but then be proactive over the next 6 months while India gets vaccinated. India has a lot of vaccination capacity. It needs to vaccinate its population. And while it is doing that, yes, we will have to continue to be careful, not lockdowns, not anything quite like that, especially if we stay proactive.
Okay. Dr. Jha, as always, pleasure talking to you. Thank you very much for joining me here on the
Thank you so much.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.